My name is Audra Ford, and this is my demonstration video on how to use a manual blood pressure cuff. Has anyone here ever used taken a manual blood pressure?
No.
Do you know what your baseline blood pressure is? I have been a nurse for over 24 years. I work in a geriatric facility, so I've seen how blood pressure plays a role in many diseases and how important monitoring is. High blood pressure is called the silent killer because there are no signs and symptoms, and it gradually increases over time. Some of the signs and symptoms of high blood pressure are shortness of breath, nosebleed, and headache. Some of the symptoms of low blood pressure are faintness. You can faint. You have lightheaded, weakness, and your lethargy, which is you become very sleepy. Now, the blood pressure affects every organ in our body. If you think about it, you have arteries and veins that go to every organ and supply food and oxygen. What the blood pressure is, usually it's a top number over a bottom number. This is your heart, which is a muscle, and it's always pumping. When it contracts and pushes the blood out of your heart into your body, that's the top number, which is your systolic. When it expands and takes in the blood, that's your diastolic, is your bottom number. From the American Heart Association, 2016, I have this graph here, which is very nice because it shows you, it's color coded, and it tells you if you're low or normal blood pressure rates, pre-high blood pressure, and then high blood pressure. Here you see in the red, those numbers indicate that you should really seek emergency help, and anything below the 90/60 for low blood pressure, you should really see a physician or go to the hospital. This here is just a graph which just gives you the numbers, and it tells you the same thing, basic information, as on the graph to your right. Okay, as I said, blood pressure affects every organ in your body. There are also some diseases that will affect your blood pressure, make it higher, such as heart disease, of course, atherosclerosis, sclerosis in the veins and arteries, as well as some tumors of the adrenal gland and the thyroid, which produce hormones which actually control the blood pressure. Now, I'm going to go over the blood pressure cuff itself. Okay, this is a normal blood pressure cuff. As you see, it has the two extensions here. This is the ball. This is the knob that you close when you're pumping it up, and you open to let the air gradually out. This one here has the dial on it. It's called a sphygmomanometer, but it's just a dial. Can you get close up? Just stop then.
I've been close.
Here you see the dial. This dial here should always be down on 0. If it's off to the side, you can't use it because you don't know how many degrees off or forward it is. This particular one goes by in units of 20. 20, 40, 60. The lines between the 20 and the 40, the long line is a 10, so that would be 30. And each little small line is 2. So your blood pressure on a manual blood pressure cuff is always going to be a positive number over a positive number. This dial is very sensitive to dropping because that's how the little dial here itself starts to move around, and you don't want that. So be careful when you're picking it up. Inside here, this portion right here of the blood pressure cuff has a balloon in it. It's like a tire, an inner tube of a tire. That's the part that inflates. This is just a little hook that we can hook this on, so we can see it when it's on the patient's arm. This one here has the word artery and an arrow. Most of them now just have a thick white line here. That's what we're going to put over the artery when we wrap it around the arm. This side, this tells you here the range of what your arm that you're going to put this at. The Velcro, anywhere between these two ranges is acceptable. If it's beyond that, you need a bigger blood pressure cuff. If it's below that, you need a smaller blood pressure cuff. If you don't have the right size, you're getting the wrong numbers. If it's too big, you're getting your numbers are too low. If it's too small, your numbers will be too high. So that's the blood pressure cuff. Then we're going to go on to the stethoscope. Any basic stethoscope will work for this. It's, the two pieces for the ear. We're going to use the flat side, which is called the diaphragm, to put onto the arm. This is what we're going to be listening for the blood pressure. Now, when applying the blood pressure cuff, can you put your arm right here? We like to use the left arm because it's closest to the heart. Before putting it on, you want to observe, you want to ask the patient, the person, if they have mastectomy. We don't use the arm if they've had a mastectomy. We don't use the arm if it's swollen or painful. And we don't use it if they have, she has a cast on her arm, or she has an IV or a fistula for dialysis. We wouldn't use that arm. We would just defer to the left arm, to the right arm, I'm sorry. So she has an arm, she has no problems with her arm. So we're going to apply the blood pressure cuff. This artery and the arrow, or the thick white line, is going to go right over her brachial artery, which is right on the inside of her arm here. This is our antecubital. It's about an inch over here. So we're going to put the artery arrow over that, above the antecubital, the bend in the elbow. It's above that, and we're going to apply it. And you see it is within our range, so we're going to just Velcro it. It should be snug, not too tight, and it should not be loose, moving up and down. This portion, we're going to lay it flat somewhere where we can see it face on. You don't want to look on from the side because you can get an inaccurate reading, so we'll lay that there. And we'll take the blood pressure cuff. I'm sorry, the stethoscope. We'll put it in our ear. We're going to put the diaphragm, the flat part, right over her brachial artery. Close the valve, and we're going to inflate it. We usually inflate up about to 160. So we'll inflate to 160. When we stop inflating and start to listen, if we hear a pulse at 160, you're going to inflate it to 170. If you hear a pulse at 170, you inflate it to 180. Because we don't know if that's the first pulse we hear, and that's what we want to hear, the first pulse. So if you hear a pulse, when you start to listen, go up 10 until you don't hear a pulse. So I'll continue and blow this up. This is at 160. I don't hear a pulse. And I just want you to see this here. You see how the dial is moving? I don't hear anything, but the dial is moving. We're not looking for the pulse. We're listening for his pulse. So even though it's beating, I haven't heard anything. So that's not her systolic blood pressure. So we'll just let the ear out. And we'll let it go down until we hear the last beat. And that will be her diastolic. So we're listening, not looking for the first beat, and we're listening, not looking for the last beat. So the first beat is the systolic, which is 120. The last beat was 80, so her blood pressure would be 120 over 80, which, according to our graph, is in the normal range. It's in the green. So we'll remove that. And then we'll talk about some what affects our blood pressure, like external things that affects our blood pressure. Exercise brings your blood pressure up. Sodium brings your blood pressure up, and it's not healthy for you. A sedentary lifestyle, smoking, will increase your blood pressure. So we want to not smoke, eat a nice healthy diet, and not taking sodium. So you should really read the labels, because there's many different words for sodium now that they can sneak it in on you. High blood pressure is everyone gets high blood pressure. It's more common in African Americans, especially African American men. So we want to have our men and our friends and family go and get their blood pressure checked and go to the have their physicals regularly to keep on top of it, because it is a disease that progresses over the years, and most people, men especially, don't go to the hospital until there's a big problem. So we want to encourage them to do that. Okay, now I'm going to talk about some, I talked about the abnormal readings here. No, I don't want to say that, never mind. Okay, I'm going to talk about some things that were, oh no, okay. In conclusion, what I would like for you to take away from this demonstration is that blood pressure is a slow moving, and it can become very lethal. It affects every part of your body. Know your blood pressure. Know how to take the numbers. Any abnormals, go to the hospital, inform your physician, and have a healthy diet, a healthy lifestyle. Your heart is a muscle. Exercise is good. And I'm going to leave my email address in case there's any extra questions or that you have for me. And most importantly, just have everyone that you know have their blood pressure checked, and bring it up as a topic of conversation. Drop tidbits of information off on people so that everyone could have a healthy lifestyle. Thanks.